A lot of patients that come into our office have been diagnosed with sleep apnea and have to wear a CPAP machine. And statistics tell us that there's a large failure rate for people who are diagnosed with sleep apnea wearing their CPAP. They're claustrophobic, they don't like the mask, they don't like the noise, they don't like the hoses. And so we have an answer for you. If you've been diagnosed with sleep apnea, we can make a dental appliance that can help you. Now, we've had patients who have come in who were diagnosed with sleep apnea, asked to wear a CPAP machine, couldn't do it for whatever reason, and we're able to make them a dental appliance that treats their sleep apnea. And it relieves their snoring that they had before the CPAP, and people who are now sleeping in the same bedrooms again where they weren't before. And you have to realize sleep apnea is a life changer. It's a killer, it's a silent killer. You can have a heart attack or a stroke, and it is completely unhealthy. So if you have sleep apnea, you need to do something to help it. And if CPAP isn't the answer, our dental appliance can help you.
So routinely you get people off CPAPs?
Absolutely.
Is that right? So let me understand this correctly. People, they're breathing fine all day long, right? They can breathe.
Yes.
But then when they lay down and fall asleep, their jaw drops back?
Their jaw drops back. It's a lot of people who have sleep apnea have a little bit thicker necks, and so the weight of their neck, once they relax, closes down their airway, and that's what snoring is. The airway starting to close, and at some point that airway collapses and they completely stop breathing. And they may do that 5, 15, 30 times in an hour, and that's why it's
so
really
you open
hard.
it up with
we
an
open it
appliance.
up and allow them to breathe. And just imagine how stressful that is to your body. It's hard on your brain, it's hard on your heart, and you don't get a good night's rest.
You say they wake up feeling better.
Oh my gosh, it's immediate too. When you get a proper appliance, you know you are better because you feel better.
What do medical doctors have to say about this? A dentist getting involved in sleep problems?
We have medical doctors who send us their patients who are CPAP intolerant. That's the official term, CPAP intolerant. And they know how important it is that the sleep apnea be treated. They send them to us so we can make them a dental appliance. It is completely unhealthy to have untreated sleep apnea.
Now, do you also work with educating doctors about the benefits of this?
Absolutely. Sometimes patients come in independently, and then once we get them better, we send a letter to their physician and say, hey, look, we did this for your patient and they're healthier now.
Now, my limited understanding, because I've talked to we have medical doctors on the show talking about sleep apnea, they have a number system. They do sleep studies.
Yes.
Do you have any comparative studies where your appliance improves their situation?
Your medical doctor, when they want a sleep study, is going to send you to a hospital or a sleep center where they will wire you up, and there's hoses and wires everywhere. And you are not in your home, you are not in your bed, and you are not going to have a good night's sleep. It will not be a pleasant experience. They may get a result for you, but you're not going to have any fun. In our practice, we send you home with an FDA-approved sleep study. It's a little blue box. You wear it on your forehead with a head strap, little nasal cannula, and it will give us everything we need, the amount of information we need for our neurologist to help give you a proper diagnosis.